to another episode of Ask the Experts. My name is Ellen McKnight, and I'm so excited about today's episode. We're going to be discussing mental health, women's health, and behavioral health. We have a panel of experts, Dr. Boggs, Dr. Mitchell, and Dr. Plummer, and they're going to be sharing some resources, strategies, tips, and best practices around those topics. You don't want to miss it. Up next, Ask the Experts.
Well, hello. This is Mayor President Sharon Westerboom once again with our third episode of Ask the Expert. And so far we have covered nutrition and health equity, and this week we will learn more about women's health and Mental Health Month. Our community here in Baton Rouge is home to over 200,000 women, and it is important for us to equip them with the knowledge they need to live their healthiest lives. So we want to make sure our mothers, daughters, sisters, and friends are around for as long as possible so we can continue to make cherished memories. And additionally, we are celebrating Mental Health Month. Our mental health, of course, affects our daily lives and well-being, and it's important that we take action to keep our minds healthy and seek the help we may need. So on this episode, we will be joined by community experts to learn more about women's health and mental health. And so I'm going to ask you to introduce yourself as I call your name. Tell us a little bit about who you are, what you do, and why you do it. So I am going to start with Dr. Allison Mitchell. Dr. Mitchell?
Yes, I am a fourth-year psychiatry resident at LSU New Orleans, and I have the pleasure of treating people for their mental illness as well as mental health from all demographics as well as in different clinical settings. And I chose mental health because it speaks to the heart of who a person is. I really enjoy connecting with people on a personal level and helping them through their problems.
Dr. Joyce Plummer.
Good afternoon. I am the project director for the Recast Baton Rouge SAMHSA-funded grant in the Office of the Mayor. I have been serving in this capacity for the last 3.5 years. We started this because of the need in our community to address mental health. After the summer of 2016, the nation recognized that there was a communal trauma that was devastating, and the mayor recognized the need to do more than fill pots, holes, but also to make sure that all of her constituents were cared for. And so this grant has been working to provide behavioral and mental health services to the people in East Baton Rouge Parish since 2017.
Thank you. And Dr. Carly Boggs.
Yes, thank you so much for having me. I am an OBGYN with the LSU Health Residency Program at Woman's Hospital here in Baton Rouge. I actually trained and did my residency at Woman's, and I'm the current clinic director as well as one of the faculty. And I'm really, one of my passions and focuses is on mental health, especially in the peripartum and postpartum setting.
Well, I'm going to start with you, Dr. Plummer.
Okay.
You mentioned Recast. And so what I want you to do is kind of unfold very briefly Recast and its impact on the Baton Rouge community.
Thank you. Recast is an acronym for Resiliency in Communities After Stress and Trauma. Resiliency in Communities After Stress and Trauma. It is focused on making sure that our citizens understand that trauma is a thing. It's a little easier today than it was 4.5, 5 years ago to help folk understand that we needed to address mental health, not from just mental issues or mental illness, but also from the lens of behavioral health and the fact that it is a public health issue in every way, just like primary care. We decided that we needed to look for avenues to help our young people understand what they were experiencing and why they were having the responses they were having, but also we needed to help families, the families of vulnerable youth in particular, families in generally underserved communities know that when you have certain actions or events that occur in your early childhood, it has a lasting impact on how you process all of the circumstances of your life and how you are able to navigate society. What many people take for granted becomes truly challenging and can lead to more intensified mental health issues in your later years. So we have focused on ACEs training, which is Adverse Childhood Experiences. We have also focused on making sure folk understand, one of the goals being when you have issues that are cultural, that are social, and may not even reflect you personally, but are systemic, those things also impact how you're able to move through daily life. And so we have tried to incorporate many of the nonprofit organizations that are boots on the ground, working very diligently to make the quality of life of our citizens here in Baton Rouge and just enhance it in every way. And we have been very fortunate in that we have a very robust coalition of members that cross government, lay, profit, nonprofit lines, and we are happy to serve the citizens of this great city and this parish.
So now, Dr. Mitchell, Dr. Plummer mentioned a word that I want you to expound on.
Sure.
And then I want you to define a couple of other terms for us, if you would. Dr. Plummer talked about trauma. I will tell you, for me, as mayor, understanding trauma has been a growth experience for me.
Yes.
You know, really, when we talk about traumatized communities. Now, because of programs like Recast, I understand it a whole lot more.
Yes.
But help us understand trauma. Help us understand the difference between mental health and mental illness.
Certainly. So trauma oftentimes leads to mental health issues, but not necessarily always mental illness. When you think about mental health, you think about your emotional well-being, your psychological well-being, your spirituality, how your emotions and behaviors play out every day. When you think about the concept of mental illness, these are conditions that affect your behaviors, oftentimes in a dysfunctional way. So with mental illness, oftentimes people and families feel that there is a shift and a change taking place, and that there is a need for intervention, whether it be therapy or whether it be a medication. And when you talk about the specific term trauma, it can be very different for different people, and so it's oftentimes hard to nail down what exactly was traumatizing to you. So it takes a conversation and an understanding by that individual. Where was there an experience that I had, whether I saw it or had it myself, that changed how I perceive the world and how I believe the world perceives me?
Mm.
That's great clarity. I'm going to shift a little bit now, and I'm going to talk about an issue that has become really dear to my heart when learning about it, and that is maternal health, infant and maternal health. Dr. Boggs, you have been participating with us in our newly organized Maternal Health Coalition, and thank you so much. So one of the issues that we discussed in our recent conversation was around postpartum depression. Mm-hmm. Share what that means to us.
So the term postpartum depression is kind of the overall umbrella term that most people use, or they'll say, I had postpartum with a previous pregnancy or after a delivery. What we're learning now and really trying to tell our patients about and educate and talk to them about is that it's really perinatal mood and anxiety disorders. So there's a huge anxiety component as well. And in all factuality, the perinatal mood and anxiety disorders is the #1 complication of pregnancy. So we hear about hemorrhage, we hear about hypertension, which are incredibly important and things that we absolutely should focus on. But 1 in 5, a lot of statistics say 1 in 5 to 1 in 7 women will experience a perinatal mood and anxiety disorder during their pregnancy or postpartum period. And there's so much stigma around it, as we all know in our profession. And so we're working really hard to screen appropriately in the perinatal period and postpartum period for anxiety and depression, as well as refer all of our patients to appropriate counseling or medication resources that we as OBGYNs can offer them.
So as an OBGYN focused on the health and well-being of women, of course, beyond postpartum depression, what are some chronic issues that you see some of your patients dealing with?
So one of the things that pregnancy is such a gift is that it gives us an insight into future health. Well, there's a ton of research now saying, is it the chicken or the egg effect? So, chronic hypertension during pregnancy, gestational diabetes, these women are exponentially higher risk of developing type 2 diabetes, chronic hypertension, cardiovascular disease later in life. And so when you add on top of that all of the traumas in their life, all of the stress, and obesity, domestic violence, poverty, the chronic illnesses that we see in our older population really shouldn't surprise any of us. And our goal is, if we can have healthy pregnancies and improve the health of the patient, we can improve their long-term health, which can improve the health of the overall family.
So we're going to wrap up, and I want you to certainly share with our audience maybe a project that is near and dear to your heart, something that you think would be enormously resourceful for our audience to connect with. But I'm going to start with you, Dr. Mitchell, and I have another question for you, and you can also share in that. And give us a mental health tip as women that we should embrace and integrate into our lives?
Certainly. So I'll start with a resource. One resource that I have been a part of for the past probably 5 to 7 years is called Be Brave Baton Rouge. And this is an initiative that was put forth by a friend who experienced postpartum or perinatal anxiety herself. And she was able to seek help. And so her initiative is essentially to help other women identify and cope with mental health issues. And they're a nonprofit organization, and they have things that go on monthly and weekly to help benefit the ladies in our community. So I'm very passionate about that. And as far as a tip for women in particular, I treat a lot of women from a diverse background, all educational levels and ethnicities. And what I find is a common issue that brings about mental illness or distress is the inability to set healthy boundaries, whether it be with their family, their personal relationships, their careers, or perhaps even in marriage. So that it would definitely be a tip that I would tell my ladies to really think about.
We can have a whole nother segment on
Yes.
that. So
Yes.
we might have a follow-up. Dr. Plummer. Now, Dr. Plummer, I'm going to add a little caveat to yours, because I don't want people ringing your phone at night thinking you're a physician that can respond to their health care needs. But
No.
you are a JD.
I'm Juris Doctor, that's right.
So,
Thank you.
But certainly tell us what program that you would like to, I know recast, but.
And Mayor, I'm telling you, we have the best coalition, pardon me, ladies, in the city, in the parish, in the country. They will be highlighted this month, as a matter of fact, because of the work that's being done. I don't know that there is a particular project, but I would encourage all of our viewers, listeners, to go to the Recast community platform on the web, reach out to, you can reach out to Family Services of Greater Baton Rouge, Eternal Crisis, Evaluative and Developmental Services, Growth Services of Louisiana. You can reach out to dozens of partners that have joined with us to address trauma in this nation, particularly after the pandemic. The transformational nature of education and awareness activities and the type of work that our peer support specialist, Tanja Miles, does is incredible. We cannot thank them enough. And I started calling names, and I know many have been left out, but I would say that no, I cannot provide the clinical services you need, but if they would address the warm line that is available on the website, they will be able. We partner also with Capital Area Human Services and with the Office of Behavioral Health for the state. So we have access to many clinicians that are available.
Last but not least, Dr. Boggs.
Yes, so I am very proud, as you mentioned earlier, to be a part of the Healthy Baton Rouge initiative. I am so thankful that our community also recognized a lot of the areas that we as a coordinating group felt were important, specifically maternal and infant health, which made it to the top floor the first time this year. And we are working, we have multiple different work groups set up to work on different initiatives towards maternal and infant health, utilizing all of the hospitals in Baton Rouge, something that we all are very passionate about and know really will take our community to the next level. In terms of recommendations, I would say to remember for women to take care of themselves first. What I see in practice is that women take care of everybody else and don't take care of themselves because they're giving so much, and remembering that taking care of themselves is just as important.
Well, thank you so much. This has been such a rich conversation, and I want to thank everyone for joining us once again on Ask the Expert.
Thanks for having me.
Thank you.
Thank you.
I would love to thank our mayor, Sharon Weston Broome, and her office at this wonderful Healthy BR initiative that we could host the Ask the Expert series here at the Capitol Park Museum, where you can feed your soul. And while we're thinking about what healthy things to eat and how to keep our bodies healthy, it's wonderful that we can also feed our minds and learn about our history and culture here at Capitol Park Museum. Please come visit.